Which of the following best explains the verbal memory impairment in this patient with right temporal lobe epilepsy? So right temporal lobe epilepsy, if you remember temporal lobe epilepsy, drug of choice is carbamazepine. All right, so we're going to read and see what happened here. A 28-year-old woman is evaluated for episodes of deja vu, followed by staring and lip smacking lasting 1 to 2 minutes, occurring 2 to 3 times monthly for about 6 months. So temporal lobe seizures tend to have, if you remember, temporal lobe has hallucinations. They have hallucinations prior to their seizure. You can also call them complex partial seizures. She reports no memory of the event. That tells you that it was generalized, but feels confused for several minutes afterwards. That's called a postictal period. The mechanism of postictal period, remember, is that you've used up so much energy in the depolarization process. So a lot of neurons are depolarizing, and then they're trying to reset their memory potential. In order to reset the memory potential and reset the concentration gradients of electrolytes, you have to use sodium potassium ATPase. So you burn up a ton of ATP right after the seizure, and that's what you're seeing as the postictal period. So MRI of the brain shows right hippocampal sclerosis. Her husband notes she cannot respond appropriately during episodes. That's the postictal period. MRI of the brain shows right hippocampal sclerosis. So the right side of the brain is scarred. Video EEG monitoring captures a typical episode with ictal onset in the right mesotemporal region. The seizure starting in the right side of the brain, and that's why you've got right hippocampal sclerosis. Neurophysiology testing reveals impaired verbal memory despite left hemispheric language dominance, confirmed by WADA test. Now notice, now they're talking about the left side is being affected. Remember, it started out with the right side. Now the left side is also involved. This is something that's characteristic of temporal lobe seizures. It starts out on one side, but it can actually depolarize and cross over to the other side so that you can affect the other side as well. All right, which of the following best explains a verbal memory impairment in this patient with right temporal lobe epilepsy? So we want something that speaks to that. Developmental anomaly. This is answer E. Developmental anomaly with reversed hemispheric specialization. No, it's not reversed. D says medication effect from anti-epileptic drugs on left hippocampal function. They haven't even mentioned a drug being given, so we can't consider that. Seizure propagation to the left temporal lobe causing bilateral dysfunction. Okay, so that says it, so we hold on to C. B says functional organization with bilateral hippocampal involvement in verbal memory. No, it doesn't say it the right way. And cross-cerebral dominance with right hemispheric language representation. No, we just want something that says the seizure can cross the other side. So big letter C, and move on to the next question.